It's 2 a.m. You're sitting in the nursery, exhausted, and staring into the crib. Every little snuffle or sudden pause in your newborn's breathing sends your mind racing, wondering if what you're hearing is a normal quirk or a reason to rush to the emergency room. That anxiety is rooted in a biological reality. Newborns can deteriorate with terrifying speed. Because they lack the ability to communicate localized pain, an illness can progress from a mild symptom to a serious condition before you've even finished your morning coffee. The difficulty lies in the information gap. As a new parent, you are constantly forced to differentiate between the bizarre but harmless behaviors of a developing human and the signs of a rapid onset medical emergency. To close that gap, we have to establish a clear baseline. By defining the exact physical thresholds of danger, we can remove the pressure of the unknown and triage these midnight moments with clinical accuracy. Learning exactly what is safe to ignore provides a framework for these decisions. It allows you to move past the initial panic and focus your attention on the specific physical checks that actually matter. Let's start with the basics of infant sleep. It is biologically necessary for a newborn to sleep up to 18 hours a day. They wake, they feed, they soil a diaper, and they sleep again. On its own, a heavy sleep cycle is not a warning sign. The medical red flag is lethargy. This is a state where the baby is completely unresponsive to touch or refuses to wake for essential feeds. If you try to stimulate your baby and they cannot maintain the energy to suck or even open their eyes, it can indicate a serious infection or a metabolic issue. Crying follows a similar logic. Healthy babies cry when they are hungry, wet, or gassy, and they settle once that need is met. But inconsolable crying, a high-pitched, continuous scream that persists after all basic needs are satisfied, is a sign that the baby is experiencing internal pain. Breathing patterns can be equally alarming, but are often normal. Newborns are periodic breathers, meaning they frequently take rapid breaths followed by brief pauses. Because they breathe almost exclusively through their tiny nasal passages, even slight congestion will sound loud and congested. True respiratory distress looks different. Watch the nose and listen to the exhale. If the baby's nostrils are flaring wide with every breath, and you hear a distinct grunting sound as they push air out, their system is struggling to oxygenate the blood. You also need to watch for chest indrawing. As shown in this diagram, if the skin is physically pulling inward at the neck or under the ribs with every gasp, the baby is using accessory muscles to force air into their lungs. These potholes are a clear sign of a serious chest infection. While a newborn's rhythms are naturally erratic, recognizing these specific mechanics of physical struggle is the key to identifying a respiratory failure before it escalates. Moving to the baby's surface, many parents panic when they feel a baby's head radiating heat. However, a warm head is often just a normal quirk of how infants regulate their body temperature and isn't a medical concern on its own. The line for a true emergency is very specific. For any infant under 3 months old, a temperature of 100.4 degrees Fahrenheit or higher is an absolute emergency. At this age, we do not wait and watch. A fever must be investigated by a doctor immediately to rule out serious infection. The baby's skin also provides a visual baseline for internal health. It's normal for newborns to look flushed when crying, or for a mild yellow tint, jaundice, to appear in the first few days as the liver matures. However, you must monitor the stool color alongside that yellowing. As this chart shows, normal newborn stool is yellow or mustard colored. A stool that is stark, pale white indicates a liver or biliary obstruction that is preventing the body from processing bile. Finally, look for cyanosis. While a baby's hands or feet may turn blue if they are cold, a blue or pale tint that is centralized around the lips and tongue is a direct signal of dangerous oxygen deprivation or the onset of sepsis. Temperature and skin pigment act as an external dashboard, revealing invisible internal issues before they have a chance to progress. Now let's look at intake and output. Most newborns will spit up a small amount of milk after feeding due to a weak valve at the top of the stomach. This is a common mechanical issue that usually resolves as they grow. The danger sign is projectile vomiting. If the baby is forcefully vomiting most of their feed, or if the vomit contains green bile or streaks of blood, it signals a potential intestinal blockage or a serious infection. Hydration is simple math. Over 6 hours without a wet diaper indicates acute dehydration needing immediate medical intervention. On this dual dashboard, we also track weight. Early 10% weight loss is normal, but a flat growth curve after 2 weeks signals severe malnutrition. In the nervous system, you have to distinguish a normal jittery startle from a seizure. Rhythmic, repetitive jerking of the limbs or a sustained stiffness that you cannot stop by gently holding the baby's arm is a sign of abnormal brain activity. You should also inspect the umbilical cord daily. While the stump should stay dry, any redness, swelling, or oozing of yellow pus is a sign of an umbilical infection that can quickly lead to sepsis. Tracking these specific metrics, input, output, and movement, provides you with objective data to rely on, even when sleep deprivation makes it hard to think clearly. Navigating these first few months is a challenge, but by learning these baselines, your midnight anxiety is replaced by a steady, educated confidence. There is a golden rule taught to every pediatrician: never ignore a mother's intuition. Medical professionals are trained to listen when a parent says something feels wrong, even if the symptoms aren't immediately obvious. You spend more time with your baby than anyone else. If you have a gut feeling that your child isn't right, even without a fever or a cough, that is a valid and sufficient reason to seek a professional medical opinion. These clinical danger signs aren't meant to replace your intuition. They are meant to arm it with the specific vocabulary needed to get your baby the right help at the right time. If you've had a close call or a scary moment with your newborn, share your story in the comments. It might be exactly what another parent needs to hear. Stay vigilant, trust your instincts, and make sure to subscribe for more guidance. We'll see you in the next one.